An important thing in health is to prevent and promote. Just like they say, prevention is better than cure. If we were to take responsibility for our health, and if we were to do most promotional, educational talk, health promotional and preventative measures, it would save Department of Health, it would save communities, and it would save us a lot of money. But that is not always feasible. That is why we are here to correct further damage that can be brought about incorrect use of medication. Greetings family, I hope everyone had a lovely day today. We are focusing on NSAIDs. NSAIDs are non-steroidal anti-inflammatories. They are used for pain. Most people use it for arthritis. You have seen them before. They come as pink or brown. Examples are diclofen, which is brown. Most people call it a bicycle. And you get ibuprofen, which usually come as pink, but the shape and colors may vary depending on the design of the company. As you know, in medication we have different brands. They are normally prescribed by doctors in the public facilities for people who have pain and arthritis, and they are also readily available over the counter. As they are over the counter, they don't require prescriptions. The most important thing I wanted to emphasize today is if you are taking those medications, you need to make sure you take them after food, because they have a tendency of hurting your stomach lining by inhibiting the housekeeping prostaglandins, which is what is protecting your stomach, thereby causing side effects such as ulcers, heartburn, any high acid related problems. Could be a dyspepsia, indigestion, which can present as a discomfort or pain in your stomach. That is why it is important that you eat before you take them. However, in some instances, the pain can be worse, the pain can be unbearable, and because they are very affordable, people tend to buy them a lot. It is advisable or recommended that you take proton pump inhibitors such as omeprazole and many other more. Omeprazole is usually marketed under Omes, Omeflax, Probata. There's many other. If you go to pharmacy, your pharmacist can advise you. Those one, you have to make sure that you take them an hour before you eat or half an hour before you eat. Then you eat, and after that you can take your pain medications such as diclofen or ibuprofen or any. Some people, they even suffer from period pains, they take these medications. So usually they are used for pain management. It's just that people who suffer with joint problem or arthritis, they are the ones who usually take them, especially our older grannies and moms at home. So another side effects that they cause is at high doses, when taken more regularly or frequently, they can cause damage to your kidney. So when you're already suffering with kidneys, or if you have any kidney condition or suffering with ulcers, you are not advised to take those medications, as I've said, but unless really you feel like, okay, the pain is unbearable. So when the pharmacist refuses to give you medication, it is important that you go to see your doctor for these reasons, because some medication can be harmful. You need to do further investigations to see what is actually causing your pain, and that is why you need to see a doctor, and they can prescribe a better drug or better medication. Exercising is very important. Exercising is very important, especially for people who are obese or a bit overweight, because it stabilizes your joints by strengthening the muscles around your joints. And they also, when you exercise, it also increases your synovial fluid, the lubricant that you get, especially for people who suffer with knee pain or knee joint. There's a lubricant called synovial fluid that keeps your joint lubricated. So when you exercise, it can also promote the production of synovial fluid. And it is important. Most people have medical aids, and some funds, they even expire, they get forfeited without them using. Use those benefits. See a physiotherapist, Physiotherapists, they are very good because they learn more about movement, they learn more about rehabilitation, rehabilitation, yes, and they learn more about body functioning. So according to the article that was published on the 24th of February 2025 by Yes Physiotherapists, it was recommended that actually exercising is the gold standard for osteoarthritis, because before people were told just to sit because they'll be hurting their knee or joint, but when you exercise, you're actually helping your body. And remember, when you visit the physiotherapist, they will tailor, you will get the exercises tailored for you. You get exercises individualized for you based on your condition. They could advise you to walk, they could advise you to cycle, they could advise you to take aerobics, but you need to see them there because they can better advise you. One thing about health, no one works alone. We are all part of the multidisciplinary team, so it is important that you also contact. If you can't, maybe see a physio, and also you can't take the oral medication because of the side effects I've listed before, you can get the non-steroidal anti-inflammatories in a gel form. You get the Panama gel or also Voltaren gel. You can use that to wrap. You can also supplement your calcium and magnesium, but I always say too much of everything is bad. So when you take supplements, maybe you can check first with your doctor to check your kidney function, because you don't want anything to affect your kidneys. And then I think most of us have come across our mothers at home. I remember my mom, I hope she won't kill me for this, at some point when she was working for the company that I won't mention before she moved to clinic, she would complain whenever she does her laundry. I'd say, oh, is it something shongo? You know why? When you use cold water, it causes stiffness to your joints. And remember, the joints in your hands are very small. So you when you're wringing your clothes, you're putting pressure in a small surface area. Physics student would be happy now. So that causes more pressure. Yeah, so that is why when you use cold water, it gets painful. Avoid cold water, and also too much of hot water is also problematic, as it can cause inflammation. So just use warm water. Yes, exercising is very important. Healthy living is the key. Prevention is better than cure, and we always aim to promote health. I hope this episode helped you. Remember to always eat before you take your Nurofen, your Panamo, diclofen, all the non-steroidal anti-inflammatories. Always ask your pharmacist for direction. Your pharmacist, they are always there to help you. Your doctor, all the health practitioners, they are always there to help you. Take care. Thank you.